Evidence-based practice is best defined as a web of aspects that make up a good formula for high-quality services. So, services that reflect the interests, values, needs, and choices of individuals with communication disorders. So, the three aspects are clinical expertise or expert opinion. This is gained through professional experience and training, and then evidence that can be external or internal, and using the best available information and resources. And then the last one is client, patient, and caregiver perspective, which is unique to client identifiers that aligns to them. The Code of Ethics is a set of principles that are purposefully and specifically set in place to ensure professionalism and an unbiased environment and community for clients, their families, employees, and supervisors. So my scenario that I chose is an SLP is working with a 4-year-old child diagnosed with a phonological disorder, specifically cluster reduction, and based on research and clinical best practices, the SLP recommends a well-supported intervention to help them recognize and correct their speech patterns. However, the child's parent refuses this approach and she insists on an articulation drill because they believe that their neighbor's child improved with that method, and she believes that this is the method that's going to work for her child. So she says no to the SLP's intervention recommendation and asks for this articulation intervention specifically. So, some of my solutions would be first to educate the parent. The SLP should explain the difference between an articulation disorder and a phonological disorder, and then from there describe why there's different interventions for each and why that articulation might have worked great for the neighbor child, but the phonological intervention that the SLP has picked out and planned for her child is going to work best. And then next would be to make sure whenever she's acknowledging these concerns and really pushing for that other intervention that you explain and listen empathetically and validate her concerns and her thoughts, and don't just ignore her and immediately tell her she's wrong and that you're smarter and you're right and you're the professional, but to still take all of her opinions and her wants and her needs in consideration, but in the end address any misconceptions and continue to inform and educate. And then the next solution I had would be to suggest a collaborative approach. So an idea I had for this was, if the parent really loves this intervention, maybe you can help tweak it and adjust it and help her use something similar at home to that articulation intervention. And while the client is with you at the clinic, the SLP would still conduct the intervention that they had picked out for the child. So while still trying to accommodate to the parents' wants and needs and offering that idea for them to work on a similar approach at home, but still doing your professional, knowledge, and using your professional knowledge and doing that inside the clinic. And then in the end, if you need to refer her, you could refer them to a different SLP and they can deal with that with their own opinion and come to their own conclusion. So to connect this to the ASHA's principles, it connects to ASHA Principle 1 because the SLP ensures the child receives the most effective treatment. The SLP should not just adjust to what the parent wants. They should do what they know is best. And then ASHA Principle 3, the SLP must not provide treatment that is ineffective for the diagnosed disorder. So that is why she would provide treatment for a phonological disorder and not an articulation disorder. And then ASHA Principle 4, the SLP has a duty to educate caregivers and advocate for the best practices. So that was seen in part of the solutions. And then connecting it to EBP, the clinician should use scientifically validated treatment approaches, which is what she is trying to do by providing a intervention that fits the disorder of the child, and then the SLP's ability to evaluate and apply research-based interventions effectively, and then considering the family's concerns and preferences while ensuring ethical and effective treatment. That's all. Thanks.